So I'll just share my screen. So thanks to Notch for inviting me to talk on this really interesting aspect. So I'm going to talk to you today about research projects. How do I get started and how to identify a good research project, and also some guidance regarding funding applications. And so if I go into just a little overview. So what I thought was I could start with some sources of inspiration, and just thinking about kind of what kind of researcher you are, how to frame a question, some examples from my work and the lessons I learned through doing this, and some sources of funding, and then some tips on how to do funding applications. And absolutely happy to answer some questions at the end, and I'll try and leave at least 5 to 10 minutes for that. So I think we've got half an hour, haven't we? So just in terms of sources of inspiration, so I just really put some very general ones here, and I think really the top one for me would be actually for patients. So often in clinics, you have patients asking you questions regarding their treatment, or kind of things like scheduling of treatments, and those kind of questions actually are really great sources of inspiration, and can be really good kind of things to start off your research projects, because actually one of the things that we as clinicians and researchers in kind of a more clinical focused area is to actually improve outcomes for patients and also their quality of life. So I think that's really important to kind of highlight, and a great source of inspiration. And then you have things like journals and conferences, and what I would say as a really great source of inspiration there is actually not just looking at the abstract, but looking at the discussion, and actually trial protocols. When you go through those, you can actually glean quite a lot of information about where that medic or researcher thinks the field is heading, and the discussants in the conferences often can really frame things in a great way, and that actually is a really great source of inspiration. And then the social media is a thing that has really kind of come through definitely over the last few years. I go on Twitter quite a bit, but obviously there's other platforms, but actually I find that a really great way of firstly keeping really up to date. People often post on there before really it's kind of in the main journals, and also you can hear kind of people's reactions to that, and so it can be a really useful source. The other source is things like collaborators. They might come to you with ideas, and also just chatting to colleagues in the corridor, and also students. They often can really ask very in-depth questions, and actually sometimes you don't know the answer, and then you have to think about, well, why don't I know the answer? Can we find out? So that's another great source of inspiration. And then the past actually is a great source of inspiration in terms of how people approach problems. So the actual topic might have changed a little bit, but the approach might still be the same actually. And I'll give you a really great example from that, from my own research. So those are kind of the major sources that I could really think of, but obviously I'm sure there's tons more. And I think one of the other things to think about when you're kind of really starting in this journey of research, and all the way through really, is the kind of researcher that you want to be, because actually that will then start framing what your interests are and kind of what areas that you want to grow in, and that's really important because you can't do everything, so you have to kind of put your eggs in a certain basket. So, you know, these are just a few ideas in terms of kind of what types of researcher you might want to be, I would suggest that probably most of us are either between translational and clinical trials, but there's obviously lots of other areas in this kind of researcher, and you might have like go across different areas. And I think then you have to think about what topics actually interest you the most, because actually you're going to be doing this research for, you know, ages, years and years. So you want something that's really going to interest you and has legs, that isn't just going to be a short period of time. And I would say to build up a portfolio of research in a certain area, then you get known for that and become more of an expert in that. And then that kind of then seeds further areas of interest. Obviously people do cross areas and topics, but I would say it really helps, especially at the beginning, to start to try and focus in on a few set areas that you want to develop. And then it's really what you can deliver on. So you might have like really interesting ideas, but then if you have to think about what skills you have as well, or how you can develop those, and if you can develop them, then that's great. But you know, there may be certain skills that you find quite tricky, and that's absolutely fine. And so recognizing what you're not good at is actually a really good thing, and then you can actually then think about how you could collaborate with someone, for instance, and that is good. And I would give an example of myself really, where I basically just did GCSE maths. I'm really bad at maths. I'm like, it's not an area that's I'm particularly good at. So, but I was really interested in mathematical oncology. And so then I ended up collaborating really nicely with some mathematical researchers. And actually, that's a really fruitful collaboration, because I've got the skills to give them in terms of developing clinical trials, and they can do that kind of background stuff of the mathematics. So, you know, it doesn't mean that you can't do a certain area if you don't have those skills, but it's just recognizing where your weaknesses are as well as your strengths. So then it's thinking about what makes a good research project. And obviously this is a very short list, and there's lots of other things that I could focus on. But I think the main thing for me is that it's something that interests you, because really it's you've got to want to get up and do it. Otherwise you won't do as good a job. So and there's so many things out there, there's bound to be something that interests you. And also I would say that generally something that addresses an important question in the field is really obviously important, and that's more likely to get you funding. A project that's beneficial to patients. Now, I've put this in just really because this group of people is, I think, more clinicians, and this is actually our strength, and we should be happy about that, and actually something beneficial to patients is really good. Obviously, a lot of amazing things have come out of basic science, for instance, CRISPR, and the kind of the effect of that is then seen translationally down the line. But I would say thinking about what your strengths are and something that is beneficial to patients is a good area. And then things like a novel method or technique, or a novel way of repurposing an old technique. You'll find time and time when you start looking back on older journals that actually the same kind of things come up in waves, and there's definite trends. And actually those people that drive those novel techniques tend to kind of run with it then once they publish that first paper. And then I would say think about it as an overall strategy to develop your skills in a certain field. So if you start like chopping and changing between lots of different things, you're not going to really kind of develop yourself in a certain line, whereas you can build on skills as you go through your research and your research projects, and that's actually quite a good way of doing things to become an expert in that area. And so moving on to how to define questions and aims, and I think this is really important because actually it really is what your whole project stems from. And so if you actually get the wording right, and make sure that the question is exactly what you intend it to be, then actually a lot of things will follow on from that, and the aims as well. So, and I would actually get others to read that question and to ask and tell you their interpretation, because actually you may have written it and you think you know what the question is, but when they read it and say what they think you've said, then actually that can be quite different. So it's really important, because that's also what, for instance, the grant reviewers are going to be looking at, and peer reviewers later on down the line. So it's really important to get that right. And I thought I'd just give you an example. This is from the detection study that I'm involved with. And so we wrote, this could be one of the main aims. So to study whether survival can be improved through early identification of micrometastatic progression identified by ctDNA. And then what I've just done there is added in 2 words, and treatment, and it completely changes the objectives of your study. So then it becomes a treatment-based trial, and that's obviously a whole different ball game. And then if you then change the wording to say whether relapse instead of survival could be prevented, then again, that completely changes your primary endpoint for your trial. So it's really important, and I hope that shows how just slight changes in the wording can really change kind of what your aim is and your question is. And so I thought I'd just give you a couple of examples of trials that I've been working on, just to give you a few kind of lessons that I've learned in the process of developing these. So the first is the Cactus trial, which is basically looking at whether circulating tumour DNA can guide a switch of treatment from targeted therapy to immune therapy in melanoma, and whether that then potentially could benefit patients. It's a small pilot study at this stage. And so really kind of going back to when we first started thinking about it, it actually came out of work I was doing in my PhD with a postdoc, where we basically found that if you monitor patients on treatment with circulating tumour DNA, you can see how they're responding and how and when they progress on treatment, and that may be before scans. And this was in stage 4 patients. And so my boss at the time suggested that we could design a trial. And obviously I hadn't done anything like that before. So I was kind of had to really think about things. And I guess really one of the things that I wanted to kind of point out was we could obviously track how people were responding to therapy, but actually, was it useful to switch patients when the ctDNA showed that they were progressing? Because actually we knew at that time, even this was like probably about 2015, that basically patients you could treat beyond progression and they would still benefit, and that was even RECIST progression. So it didn't seem that circulating tumour DNA for melanoma anyway would be useful in that context. And so it was really hard to kind of start thinking, and then we started thinking about how sequencing of treatment was really important. And actually there was some initial data coming out that targeted therapy could improve responses to immune therapy in melanoma. And so then that kind of like through chatting to mentors, and Paul Lorigan was particularly a great mentor for me, then we were able to design the Cactus trial, which essentially is looking at whether if we switch in maximal ctDNA response from targeted to immune therapy, whether we can improve responses to immune therapy. And so really then, because again, not done this before, then it was how do we get the money? And actually we ended up asking pharma, and after a number of different discussions with BMS, they agreed to fund the study. And so what I wanted to really highlight to you, the lessons learned from this for me were to find a mentor with whom you can bounce ideas around with. So, you know, sometimes I'd go to Paul and just say, what do you think about this? And he'd be like, no, it won't work because because of this and this reason clinically. And I think that's really important, because people with more experience are really great at kind of pointing out the benefits and the weaknesses of your ideas. And it also has to be something that will progress the field and potentially benefit patients. So just because you can do it doesn't mean you should. So we could potentially look at kind of switching people as soon as they're progressing, but I don't think that would necessarily be the right thing to do. And so you have to, even though you might have a really cool new novel technique, actually when it comes to then using it in the clinic, it's a whole new ball game, and you have to really think carefully about how it would actually benefit the patients. So that's really important. And then for trials, I would say it needs to be an idea that's going to be relevant even a few years down the line. So we started discussions about Cactus in 2015, and you know, it's recruiting at the minute, but the question is still relevant for the melanoma field. And that's really important, because it takes like usually at least 9 months to set up a clinical trial. So it has to be something that's not going to be overtaken by, for instance, a new standard of care. And the other thing is that they can only say no. So it is definitely worth approaching pharma and thinking about who to apply for grants to, because actually at the worst, all it is you spending quite a bit of time, but then, you know, all they can do is say no. So I thought I'd just then move on to sources of funding. So pharma, they have usually specific calls for funding, and it's quite hard sometimes to know when those come out, but often the reps are quite good if you ask them at letting you know. And you can actually approach them as well with an idea. It's often easier if they do know you already. So for instance, I've often done things with Paul Oregon because they obviously know him really well, and then hopefully then they would start to get to know me. So if you kind of email them out of the blue and they don't know you, I think there's less chance of you getting further with them. It is fairly important to have a confidentiality disclosure agreement in place, just because you're basically telling them your IP, so you need to kind of make sure that that's all kind of watertight. It does take time, and often these meetings happen over quite a number of months, so that's important to also think about, that none of kind of trial work happens overnight really. And also probably the most important thing is it needs to fit with their strategy. So pharma, you know, there's things like if there's a new indication for the use of their drug, that will be particularly interesting to them. So that's important, just to make sure that you can align your interests with theirs. And so then I thought I'd just give you another example of the detection trial, which is a phase 3 trial. And this really shows you kind of how things go from bench to bedside. So this started off with the idea that we were working with patients with stage 4 melanoma, looking at the circulating tumour DNA. And then I asked the question of whether it could be used to detect minimal residual disease or early relapse in an earlier stage 3 patients. So really that kick-started a whole process. So initially we actually in 2015 proposed to get samples from the Avastem trial, which was in stage 3 patients, so we could look for that signal of whether it could detect relapse, and we had the outcome data. So we published that in 2018, and we showed that, yes, indeed, if we detected circulating tumour DNA, patients were very highly likely to relapse, whereas if they had undetectable ctDNA following surgery, they were much less likely to relapse. And so we then designed the detection trial and submitted an initial proposal to CRUK in January 2018. However, in May, they came back to us and said there should be a major design change. And that's like also something, actually, a lot of these comments are quite useful, and it's important not to take them personally and to think about what the reviewers are saying. And actually, this was really, really helpful for this trial. So they told us to look at this old trial that had been done in ovarian cancer, the OV5 trial, looking at early versus delayed treatment, and that was based on CA125. So it's quite a similar design, and I emailed Professor Rustin, and he was so helpful and gave us like the trial protocol and everything. So it's definitely worth looking back at the past, and especially clinical trials, because actually they might have really good, efficient designs that are relevant to your question. And so then we submitted the full proposal, had a grant interview, and you can see really this has taken almost a year, so that's normal. And then it was rejected. And that was really because we had only access to targeted therapy at the time, and not immune therapy, but they left the door open to us. So we then resubmitted it with new data as well that we'd got in the meantime, looking prospectively at this question, and then we had the grant interview again, and then published that data. Then finally it was awarded, and then January 2021 we're going to hopefully open. So as you can see, it's quite a long process, so it's really important to be still interested in it, in the question, at the end of, like, you know, 6 years. So and that's really kind of bench to bedside research, and that's actually quite quick to go from the bench to phase 3. So really, lessons learned here are that if the essence of your idea is good, you will probably get there at the end, but there's often lots of obstacles along the way, and rejection is a normal part of the process, and often it can just make things stronger, actually. And it's important to look at older ideas from the past and to recycle them for your kind of area, because actually you can learn a lot from that. And so just in terms of, I'm just seeing how much time that we've got, just in terms of sources of funding, so charity is obviously one funding opportunity. So CRUK has a lot of general grants, or there are disease-specific charities such as Breast Cancer Now. They often have general calls throughout the year, but they can also do specific calls, and it's really important, again, to read what their core strategy is. All of them tend to have it on their website, and it's important to tailor your application to that, and even try and pick out the buzzwords from their strategy and kind of almost say it back to them in your grant. It's also really useful to speak to the grants managers. They're really helpful people, and they're very knowledgeable. They're often PhDs that have come from science, especially in CRUK, and they're really helpful to discuss a grant with. Other sources of funding are, for instance, the government, which there are obviously big kind of calls and ongoing calls as well. So worth checking out those websites. Philanthropy is actually quite a useful, also another source. Often your university might have a philanthropic fund, so it's worth approaching those people. A lot of COVID stuff has been kind of got through that money. Also, you can get local seed funding. So definitely, I know Manchester University, they often have little mini calls of between about £20,000 to £50,000. And that really helps you it's a bit easier and it's quicker as a process. And it enables you to get pilot data to then kind of go forward for a bigger grant and make that stronger. So that's definitely something good to have a look at. And then just finally, in terms of general guidance for funding applications, I would say give yourself plenty of time, because these applications are really, really long, and there's often lots of sections, like adding sections, that kind of take a lot of time. They might not necessarily be like the main core of what your proposal is, but they do take time. It's important to work out when your best writing time is. So mine, for instance, is in the morning. So even if you do like an hour a day over the course of a week, but make it like a good hour. That's really important. It's really important to know your subject, and you will be asked on things during the interviews. As an early career researcher, it is really good to have collaborators who are well known in the field, because they've previously been able to deliver on their grants, and so that makes you safer to whoever's giving the money, because obviously these are big sums of money, so they want to make sure that you're actually going to deliver. And that kind of speaks to the next point, that I would say make sure you can ensure that the reviewers know that you can deliver what you've set out to deliver. So it's not, if you promise a world but it's not actually feasible, that's one of the key things that they have to look at in a grant. So I would say just kind of be aware of that. And then I tend to write a first draft, and then I have a complete break from it. I usually send it out to people for criticism, and then I basically wait and don't do anything on it, and then look at it with fresh eyes. And I think that's really helpful. And then to identify critical friends, so people that are going to be nice in their criticism, but also it's important to have people that you know are probably going to give you quite harsh criticism, because actually, you know, it's best to find out then rather than when you get the reviewers' comments back. And practicing interviews obviously is really important. So because I'm just aware of time, this is just the final take home. So I would say rejection is part of trying, don't give up. It is a long process, especially if you're working in clinical trials, and so you need to be happy your idea will be still interesting to you and valuable, probably at least 2 years down the line. It's really good to find mentors, and don't be afraid to ask for advice or collaborate with others that have the expertise that you think would benefit your project. And I would say start small in size and then build up, because actually having gone through the developing cactus, that put us in such a better position than to deliver detection as a phase 3 study. So it's worth even, doing a pilot first, just because then you kind of make all the mistakes in that. So with that, I would be happy to take any questions.
Thank you, Becky. That was a brilliant talk, and we have had some very brave questions in the chat. So I'll start off with the first one of those. And just to reassure you, we do still have plenty of time, because our next session's at 4:15, so we've got a little bit of time.
I think I could, because I thought the programme said it was just half an hour that we had. So we've got plenty of time to chat.
So the first question was how you personally manage to keep up momentum when you hit resistance, which I think is a great question.
Yeah, that's a really good question. Well, I think so when we got that rejection from detection, because obviously, it's a year of work, and then you just think, oh God. And I think it's always really hard. On the day, you just probably, go home, eat chocolate and drink wine and like try and pick yourself up, and but then I don't usually look at kind of the comments at that stage, and often they send you them a little bit later, a few days later. They often send feedback, and so when you get that feedback, then that's quite a good time to just recalibrate yourself, and just think, well, actually, have they made good points? And so for us, it was in a way it was quite obvious like why they'd rejected it, and it was fair enough, because because they wanted us to use immune therapy, and we just hadn't quite got to the stage with the drug company that we could definitely say that they would provide drugs. So it was, you know, it was fairly kind of obvious that they were happy overall with the approach, but just wanted a different drug. And so I think it's really understanding why they've rejected it. And in terms of like how you feel about it, I think it's just important just not to take it personally. It's really hard, but at the end of the day, like, it's no reflection on you as a person. And, you know, even if they completely like slate your work, then you know, someone else will probably like it. But and you know, I think I've submitted other trials that have got completely rejected outright, and then the next year resubmitted them pretty similar, and they got funded. So, you know, I think it's just, once you start kind of realizing that actually you just approach someone else, then and if you still believe in your idea, I think that's the thing, if you believe in it yourself, then you're more likely to continue. Hopefully that's helpful.
Yeah, that's brilliant, Becky. I think you're right, persistence is key, and just, you know, that's very like common in academia. You just, you know, if you have faith in something, got to kind of see it through. So great. And then another question we had was, are there any particular resources that you use when you need help setting up a trial? And if you could share those, if you
yeah. So I would say it's good to actually, there's certain key people that you need to get on your side. So the R&D at your hospitals, because they usually sponsor the study, and they cost it out for you. So it's worth spending the time going and sitting down with those people. Like I kind of did that a lot at the beginning, and now obviously we have to do it via Zoom and things, but because they know me, then they're, you know, much more receptive to things. So it's good to get them on board. They're generally very helpful people. And then I would say, so it depends, the kind of procedures depend on kind of who sponsors, and then if you have to go through university, and that's generally who pays you as an investigator. So because I'm paid by Manchester University, I have to then put a funding case through kind of their business team. And so that's another form, basically. So it's worth, that's the other thing about setting up these things initially, especially with someone that's already done it before, because often these systems, they're very local as to how you go about it, but they can be quite tricky to navigate if you've never done it before. Once you you know, you make mistakes and people are like, oh, well, why did you not tell me about this trial? And then you're like, oh, I'm really sorry, I didn't know you existed. so I've had that a few times, but usually you kind of muddle through in the end. But it is quite, like, it does feel a bit round the houses until you get used to that system, but it is quite local in terms of what that is. So, and then in terms of then who you go to for funding, it's really like dependent on kind of what the project is. And so hopefully I've given you some examples.
Brilliant, thank you, Becky. We had another question from Johnny, which was sort of how you found the overall experience of mentorship, and, you know, have you found that you've had particular role models at the Christie that have really helped you?
Yeah, I'm really lucky. I've got quite a few actually. So they're all clinicians, generally, I'd say, but I know there are programs where you can get things like from CRUK, where you can get, for example, business leaders being a mentor to you. Yeah, I basically, I would say there's I don't know, maybe about 5 or 6 people that I tend to kind of go to, but then one, like Paul Oregon, I would say would be the main person, especially because I do a lot of work with him, and that relationship has been built up over time, so he was my kind of co-PhD supervisor, and I would say, like, in terms of how you find these people, usually it is quite it's usually through chatting to them, and then you realize that, oh, they're interested in what you're doing, and they're happy to spend time with you, and then it kind of goes from there, really. I think it is important to make sure that I guess you can be more formal about it, and kind of arrange regular meetings, and that can sometimes work, but mine's tended to be quite informal, and it's really developed over time. But I would say, and it's got to be someone that you're happy to just tell it as it is, if you get your grant rejected, that you can go to them and have a bit of a sob in their office, that kind of thing. So you kind of realize who that is gonna be once you get to know them.
Absolutely. I think it's all about getting that connection right. It's kind of individual for everyone. So just moving on to another question that we had from the audience, which was advice on building potential collaborations and building those relationships. And do you have any top tips?
I've got some good stories. So one of the trials that I've worked on, that was because at a conference I chatted to someone at my institute who was a scientist, Santiago Selenai, and literally on the aeroplane on the way back, I was sat next to Armstrong, and we started chatting about his work, and then we were kind of like, oh, it would be great to do a trial. And so some of these things kind of come up through just chance, and it's good just to use that opportunity. Other times I have specifically gone and asked people, and I've probably got more confident at doing that over the last couple of years, I would say. Like, originally I would never have gone up to someone famous and asked them if they would collaborate, but I started reading a lot about mathematical oncology, and I really like the work of Trevor Graham and Andreas Soteriva, and I then just approached them and asked if they would be interested in kind of looking at a collaboration, and they were really interested, and I've met with them a couple of times since, and it's been really nice. So these things is worth just if there's someone that you really like their work, especially if they're, for instance, a scientist where they don't have that kind of, they can't get their work into the clinic as easily as obviously a clinician can, well, they need a clinician to work with, so often they're really approachable, actually, and everyone always likes people saying, oh, I love your work, so actually it's never a bad thing. So yeah, I think that would be kind of some of the examples that I've had of forming collaborations.
That's brilliant, and definitely a good tip to go in with that opening line of loving their work.
Yeah. Make sure you know it as well.
And just another question we had in the chat, which has been a bit busy actually for this session, was how much of your time is sort of split between the clinical and the academic side, and coupled with that, how much work do you end up doing in your own time, and does time training impact?
Yeah, so you've got me. Well, at the minute, because I'm a clinical lecturer, and you don't have to necessarily be interested in lab research. So I'm an NIHR clinical lecturer through an ACL, and I really recommend that scheme because it's actually really flexible. And so technically you do 50%, well, you do 50% of your time in clinical and 50% in research, but you can spend that 50% however you want. So for instance, some people do 1 day a week. I've chosen to do a whole year doing research in science. Mainly that's because I do wet lab work, and it's easier to do that kind of in a block. But the scheme's really flexible, so you can make it how you want, as long as your TPD's happy to kind of support that. And I'm really lucky that the RTPD is really like helpful. So it's worth kind of having a look at those schemes. In terms of work-life balance, I would not say that I'm the greatest example of a good work-life balance. I don't think I've managed to achieve that goodness in terms of getting a balance. You do end up doing stuff in your own time. It's really important to try and like build things in. So like it's quite hard, I think, at the minute with COVID, but just to say, right, okay, this evening I'm going to go and meet my friends, and schedule things in your diary. So then you have to do like life stuff. So I think I'm always open to tips on how to improve that, but it is something definitely just when you're in full-time clinical, like when I'm back kind of doing full-time clinical at the Christie, it's really hard. I often schedule meetings early in the morning, for instance, to try and kind of get around clinics and things. So, because you always have to put the patients first that you're looking after, so that can then make meetings hard to schedule. I think it gets easier once you're a consultant, because at least you have more charge of your diary and when your clinics are. But I'm hoping that, but it probably isn't.
We can stay hopeful for now. And I think that's most of the questions that we had in the chat. But I just wondered, like, it's great to see sort of the work that you've been doing, and I just wondered kind of how you personally decided that you wanted to do a PhD, you wanted to go down the research path. What was it that drove you in that direction?
Yeah, well, I kind of always knew that I'd want to do a PhD, because I always was interested in research. I didn't know that I wanted to do melanoma. Like when I applied, basically the reason I applied for that PhD mainly was because there wasn't really any other PhDs in Manchester at that time that were like funded. So it's funny how life takes you, really. And so I would say kind of look at all opportunities. With PhDs, it's 4 years of your life, or at least 3 years, and I would say it's really, really important to try and find out from people that work in your institute about what your PhD supervisor is like, and the kind of support available in the institute, because it is quite tough doing a science PhD, because you kind of go from being like feeling in your comfort zone as a registrar to like being quite kind of doing something completely different, and that can be quite a tough first year. So I would definitely try and make sure that the group that you're going to be working in, that there's like good postdocs that are supportive as well, because they're probably going to be the ones teaching you stuff. So definitely worth to kind of like find out about what the lab's like, and it may be better to go for a less well-known lab, but it's more supportive environment than a famous lab. So it's just important to kind of try and find out about that.
Brilliant. Those are some really great tips. And just as well, sort of just as a final question, because I think we'll probably need to get back into the main session shortly. But if there are sort of anyone on the line today who aren't considering doing a PhD but still want to get involved in research, maybe sort of coming to the end of their training wanting to get involved in collaborative projects, do you have any sort of tips or advice for those trainees?
Yeah, so well, obviously Notch is like a great organisation to try and like put a proposal into, so that's one way. In terms of like other projects that are kind of more clinically focused, then things like, it's worth just speaking to the consultants that you're working for to see what projects they often have, like little projects on the boil, so worth having a chat with them, and then kind of thinking about where, like for instance, where, like, is there a disease group that you want to be a consultant in, like who would you like, is it good to do, is there a question that would be useful to address clinically with like audit information, clinical audit information, for instance, that then you could kind of hopefully publish, and then kind of maybe build on when you're a consultant. So those kind of things I would say are quite useful.
Brilliant. Thank you very much, Becky. I don't think we've got any other questions at the moment, so I think we'll leave it there for today and let everyone just have a short break to grab a hot drink. But thank you. We really, really enjoyed your talk. And we'll all be meeting again at 4:15 for the next session. So if everyone wants to just sort of stay on the line, Johnny will repurpose us into the right group shortly, and maybe just grab a drink, go to the loo whilst there's a short interlude.
Hi, Abby. Yeah, I think Pippa is just she's just taking her last questions now. So we'll meet in 5 minutes. Okay, that's 5 minutes. Thanks. Bye.
Thanks, everyone.
Thanks, Becky.